I'm Rod Rohrich, a board-certified plastic surgeon in Dallas, Texas, helping you become a better, more informed you. Welcome back to my podcast, and I want to thank my almost 11,000 subscribers for tuning in and helping me help you become a better and more informed you about plastic surgery and all things about wellness and health. So let's take a deep dive into facelift recovery, because today it's all about the recovery process. How can we make it smoother, better, more pain-free, and more rapid? So I'm going to talk about 4 proven ways to supercharge your facelift recovery. So let's talk about some of the facts about healing. You know, healing isn't just about time, it's about the science and the strategy of how you plan to heal. And, you know, a lot of complications are preventable if you use the right pre- and post-operative approach. So we want you to heal faster, better, and minimize downtime. And now, you can't obviously, totally accelerate wound healing because that's 42 to 60 days, but you can make people feel better and recover faster after facelifts. And I'm going to talk to you about how you can do that. And I can tell you, when you take a patient like this and transform her, and so that she can be presentable, to the public eye in under 2 weeks, that's transformative. No matter what type of technique you use, obviously technique is very, very important in these types of patients. But the key is, how do you control the swelling? Controlling the swelling enhances recovery, because swelling can hide the result. It can kill it early. So what are the things that we do? I mean, we start every patient before surgery on a whole regimen of antioxidants and vitamin therapy supplements, including zinc, vitamin C, and a whole array of vitamins that I would refer you to one of my earlier podcasts on supplements that I take and also that I give to all of my patients that enhance wound healing and maintain, really structural integrity of your cell pre- and post-operatively. So it's getting your body into shape, including high protein diet, collagen, and collagen does work, either tablets or the powder. True collagen does work, much better than whey protein. But then after surgery, you elevate your head of the bed, you do manual massage starting at day 5, cold compresses, and we get people walking. We use bromelain, sometimes arnica. Bromelain is very good. It's pineapple extract. It really reduces bruising and swelling. And then, we continue to power that up. We continue to make sure that they have high protein diet, vitamin C, zinc, all of the essential elements, and we can give them supplements as well. And we continue that pre and then for 14 days post-op. And you want to avoid high sugar and processed food because that can spike inflammation very, very rapidly. So number 1 is preoperative nutrition. And then the other things that really totally ramp up your recovery are the use of photomodulation, hyperbaric oxygen, and the CO2 carboxyl mask. So let's take a deep dive into each of these. Now, amplified light therapy photomodulation really helps to promote cellular repair. There's a purple light that actually promotes cellular repair, diminishes bruising, enhances collagen production, and we use that in all our patients. We begin that preoperatively for 20 minutes before we go to the operating room, and then at the end of the procedure, we do yellow light for about 5 to 10 minutes, and then we do it every day for the first 3 to 5 days after surgery, because that enhances wound healing and diminishes bruising. So we do that, and then oxygen. Oxygen is truly the miracle molecule. So about 2 years ago, we started using episodic hyperbaric chamber therapy, but now we almost use it routinely in our facelift patients, and we're now beginning to actually build our own institute that will have hyperbaric oxygen because it is so powerful in enhancing wound healing. It increases cellular tissue oxygen, enhances neovascularization, and minimizes and enhances immune function. And so you can modulate it and do it for 5 to 7 to even 10 days just to promote normal wound healing after a facelift, which is very, very powerful and very, very important to do. And I think that's the key element here, is you want to get people looking good and feeling good early on, because you remember, swelling has got to decrease rapidly, and that's really essential to a good result. And then a very nice another innovation is the CO2 lift. It's a carboxy lift that actually is a mask that actually enhances, it uses the Bohr effect, which basically supplants the CO2 going into the skin, and it displaces, the CO2 displaces everything in that area so that oxygen rushes in and you get like a localized hyperbaric oxygen. And that enhances skin healing, reduces redness and swelling. And so it's a very, very powerful type of technique. And we began using that on the first 1 or 2 days after surgery, except with lasers. And we put it on the mask, and then we peel it off after 45 minutes. And then the patients will continue to do that for 3 to 5 sessions after surgery, all with the singular aspect of enhancing local oxygenation. It's really pretty impressive. So I would say the biggest things is nutraceuticals, preoperative supplements, and then the use of postoperative, elevation, high protein, and then the use of carboxyl masks, the hyperbaric oxygen, and then the photomodulation therapy is really, really a key element in enhancing wound healing. And I think those are the key 4 elements that really will jumpstart you to not only an enhanced recovery, but also an enhanced result. And so the key element is always ask, as part of your regimen, and this is a normal part of our post-op facial rejuvenation regimen, is that we want you to heal rapidly, we want you to heal fast, and we want you to make it a nice, memorable experience. And I think that's the key. You want to heal smarter, not just faster. And I think it's, great results are not just about having great surgery. It's about the strategy that you put into your patient and using science-based tools like hyperbaric oxygen, carboxyl masks, and light therapy to really focus on getting you better, faster, to enhance your recovery and your result. So let me know if you have any other comments, what you think about some of these concepts, especially hyperbaric oxygen, because these are all evolving science, but the early evidence-based science says they truly do enhance your level of wound healing and really get you your results that you so desire much more rapidly. But remember, it's always based upon the technique and talent of your board-certified plastic surgeon that is doing your facial rejuvenation. So know before you go. Hope you enjoyed it. Until next time, stay safe.